Hello. I thought today it might be helpful if I were to share with you my ever-evolving blueprint to hopefully thrive in the midlife and beyond. And the reason I wanted to do this is that I want to share the insights and knowledge and the framework that I'm beginning to put in place, not only in my life, but in lots of my patients' lives, to help them move beyond the perimenopause and menopause in a really healthy, strong manner and really moving into the next phase of life. I definitely don't want the perimenopause and menopause to define us, but there's absolutely no doubt that it really is a period of transition and a journey that can, for many women, be extremely challenging and certainly call into question lots of things that we have done or thought about ourselves before. For those of you who don't know me, my name is Dr. Shauna Watts. I am a mum of 4 and I am a doctor. I've been a doctor for 25 years and I currently live in New South Wales in Australia, but you can probably hear something of an Irish twang, and I'm originally from just outside Belfast in Northern Ireland. I've been a GP for about 22 years and I've always been very interested in women's health and mental health. And I also have completed extra training in lifestyle medicine. And that's where we look at the evidence base in things like diet, exercise, alcohol, and anything to do with your general life to see what we can do to influence disease and health problems before they actually occur. And then over the last 6 years, I have really focused my time and energies into helping women, mostly 35 plus, navigate changes in their skin, faces, bodies, mental health, confidence. And obviously the menopausal transition is very much entwined through all of that. Now, the great news is that the perimenopause and the menopause and the postmenopause seems to no longer quite be the taboo that it was. And thank goodness for that, because quite frankly, for years, it was something that was only whispered in hushed tones, and women were left feeling like they couldn't admit to being postmenopausal because that would mean that they were in some way old and dried up or used past their use-by date, which is absolutely awful. And the great news is that over the last number of years, probably fueled by social media and I don't know, potentially maybe an increasing number of female doctors who've perhaps undergone a tricky menopausal transition themselves, the conversation has got louder and louder, which I'm absolutely here for. It's absolutely awesome. And subjects that for so long were things that people felt really embarrassed to talk about are now becoming more and more out in the open. So I definitely also want to acknowledge that for many people, well, in fact, for all of us, the menopausal transition is definitely not just a biological event. For so long, it's been defined as periods and not being able to have a baby and maybe a couple of hot flashes. It's a profound life transition that can impact many aspects of women's and their families' and partners' life. It impacts our brains, our minds, our confidence, our bodies, our relationships. It's not just the end of periods. It's not just the end of being able to have a baby, and it's not just hot flushes. If you've listened to any of my previous podcasts, although we aren't specifically a menopause podcast, we have had a number of really great episodes with conversations with other doctors and solo episodes. So I know that many of you will already know a lot of this, but just to confirm to anyone who doesn't know, the menopause is one day in your life. It's one day, exactly 12 months after you had your last period. That's the medical definition of the menopause. Now, that's a little challenging if you've had a hysterectomy and you're not having periods, but your ovaries are potentially still working. If you've had your ovaries removed surgically, then in theory, your menopause happens that day. The postmenopause is every day after the menopause until the day you die. So often people ask me, when's this going to end? And the actual period or the definition doesn't end. But the good news is that most of the symptoms often have settled or are settling by this stage. However, as we'll chat about later on, there are definitely health consequences for women that continue onwards throughout this period. And then we'll talk about the perimenopause. This is probably quite a new phrase that has become quite fashionable over the last few years. And the perimenopause is definitely a very variable period of time. So it can be anything from 2 to 10 plus years. And it can be on average probably 4 to 7 years. So if you think about it, that in Australia or the UK and US, depending on ethnicity, menopause roughly is around 51 on average. But remember that what average means. That means lots of people have their menopause well beyond 50 and many have it well before that. So it's not beyond the realms of possibility that you could be having perimenopausal symptoms in your 30s. And the reality is, I'm not going to get into it much today, but there are definitely a group of women who have a very early menopause, premature ovarian insufficiency, and they're not a totally negligible group of women. There's a significant number of them. So, I don't mean to exclude anybody by talking about ages or middle age, because the reality is that you can have a menopause at a very young age or much older. Hopefully that's cleared up a few of the definitions and people have got a little bit straight in their head, and hopefully if you have a think about it, you know where you are. But the thing about menopause and perimenopause is it isn't just about periods. It can be so much more. But if we talk a little bit about the period side of things, in the perimenopause, what people will tend to notice are things like periods getting shorter or longer. So maybe you've had a 5-day period or bleeding period before, and maybe that becomes 2 or 3 days. Or it becomes longer. Maybe it becomes lighter than it used to be, or maybe suddenly you have these awfully heavy, painful periods that they never were like before. And the other thing that can happen in the perimenopause is that some people can have still quite regular periods, but others it becomes very irregular. And you might be having a period every 10 or 20 days, and then you might skip and not have another one for another 60 or 90 days. So really the only thing that's consistent in the perimenopause is the inconsistency. But some very recent research from the UK, actually only really released in the last few weeks, showed that a very significant number of women, 67%, have more than 12 symptoms in the perimenopause. I'm not going to go into all the symptoms today. You'll probably find them, documented in lots of places. Depending on the list you look at, there's anything from 27 to 47 to 50. I personally think there's probably about 50 symptoms that we can probably attribute to the perimenopause. But I also want to point out that we don't want to just be blaming everything on it. And it is definitely really important that you chat with your doctor, because yes, for example, you can get heart palpitations related to the perimenopause, but it's really important that we rule out that it's not something actually cardiac. Or, you can have sweats and night sweats with the perimenopause, but the reality is that you can also have night sweats with other more serious health problems that really need treatment. So therefore, it's really important that we're just not passing everything off as being, it's just the menopause. The reality is definitely chat this stuff through with your doctor. One of the things that is very frequently talked to me about with my patients is irritability. Many women will tell me that everyone just seems very annoying, and they find themselves getting much angrier than they used to. And one of the other ones that women will often complain of is forgetfulness. And I had a patient the other day tell me she was at a work meeting. She had organized a lunch. She was leading the meeting, and she was trying to communicate to one of her colleagues that she needed them to retrieve the lunch from the fridge, but she couldn't remember the word fridge. She just could not think of the word fridge, and she had to end up asking them to retrieve it from the cold cupboard. So I don't know if anybody listening can relate to that, but I know I definitely can. Sometimes I just cannot think of words, and to be honest, as a doctor, sometimes that's a little challenging. So the first thing I want to talk today in depth about is sleep. And although whenever people think of menopause and perimenopause, they always think of hot flushes, to me, sleep is probably one of the really big issues that I see day in and day out. And women are at the end of their tether with being unable to sleep. So this is a very, very common symptom. People will tell you how horrible and lonely it can feel, how they can get to the point where they absolutely dread going to bed because they just know they're going to spend the night tossing and turning. A lot of women will describe that they actually can get to sleep. So they can initially get to sleep, maybe go to sleep at 9 or 10 o'clock at night. But to be honest, within about 2 hours, they're awake. And that can be for many reasons. Sometimes it is those dreaded hot flushes or night sweats. It can also be for trips to the bathroom. But what they'll often say is their ability to actually get back to sleep becomes incredibly troublesome. They will lie there. Sometimes they're overthinking. Sometimes their mind is a whirl of ideas and worries and panicking about all sorts of things, thinking about what they've said at work the day before, or worrying about what the next day brings, or worrying about their kids or their teenagers or their parents, and sometimes worrying about absolutely nothing. But other times women will tell me that they're just lying there and they're actually not really that worried about anything, but they literally cannot go to sleep. And yet they are utterly exhausted because only the night before they only had 2 to 3 hours sleep as well. And this ends up getting into a bit of a vicious cycle because you become completely exhausted and it impacts so many things. This also impacts the irritability that I was talking about a little earlier, and women can be left feeling very unmotivated. It also impacts our natural rhythms. Our body wants us to be asleep for a decent amount of time, and we know there is so much evidence that if you don't sleep long enough, it can lead to lots of other health problems. But really, the impact on our circadian rhythms also impacts things like our eating, our metabolism, our weight, our stress hormones. And therefore, it is definitely one of the symptoms that I address very, very quickly with my patients because I know that it's actually causing a lot of the other symptoms as well. Now, of course, we talk about what is referred to in medical circles as sleep hygiene. But basically what that means is that you want to have a little bit of a routine. You want to have a comfortable bed. You want your bed to be clean. You don't want your bedroom to be hot. In fact, you actually want your bedroom to be on the cooler side, if anything. You want your bedroom to be dark. You don't want there to be noise. You don't want to be using iPads and phones and things before bed. So those are all the things that mostly encompass sleep hygiene. We also strongly encourage that you're not drinking alcohol or using drugs or smoking or vaping before bed, and clearly not having caffeine-based products either, because they're just going to hype you up even more. The other thing that really has a big part in this is hormones. And one of the hormones that actually has quite a good impact on this is progesterone. And in the menopause, we're often very, very focused on estrogen. And we definitely know that estrogen also has an impact on sleep. But progesterone can sometimes be the forgotten sister. She's extremely helpful. Sometimes progesterone is talked about in hormone replacement therapy as really just being about protecting your uterus. But the reality is that there are definitely other benefits to this incredible hormone. And one of them is helping you sleep. So I always strongly encourage my patients to take their progesterone. I like to use like a body identical progesterone, and I like my patients to take it at night time. As I said, we do know that estrogen definitely helps sleep as well. And then if we don't have a benefit from those hormones, though I have to say the vast majority of women do, or if we have a patient who just for whatever reason can't or doesn't want to take hormones, then I will often go down the road of something like melatonin, which we know melatonin is the natural hormone that we release through our circadian rhythms, and our body knows it's time to go to sleep. And that's why we don't want you looking at phones and blue light and all those things. And we'll use melatonin because we know that in the menopausal transition, melatonin is not released as much as it was previously, and it probably is impacting. And a lot of people also find benefit from magnesium as well. Now, there's no doubt that, as I talked about, the hot flushes and the night sweats are definitely a reason that people will wake up, and these are called vasomotor symptoms, and they're actually one of the first things that actually improves with hormones. So people will often find that their sleep improves and their reduction in hot flushes also feeds into that as well. Again, if you're someone who can't take hormones, there are a couple of new options on the market. So talk to your GP. They are prescription medications that are particularly aimed at hot flushes, and hoping that those hot flushes and night sweats get better and allow you to sleep. And the other thing I wanted to mention just in the context of sleep is for a lot of women, it's getting up and down to go to the bathroom that could become really, really tricky. I definitely find that using vaginal hormones in this context will often reduce that need to get up in the bathroom, to urinate at night and allow you to actually have a really nice sleep. I have to say, when I start my patients on hormones, I always review them within 4 weeks to see how we're going. We always want to give a bit of time to see what happens. But seeing people come back into the clinic and they just can't even believe it. They feel like they can actually conquer the world again. They're much more motivated to exercise, to socialize, to do everything, to cope at work. Everything feels much more manageable whenever you've had a night's sleep. You know, think about a tired toddler and how many tantrums they have and how difficult it is for them to do the simplest tasks. Well, not that I'm saying that we're toddlers, but you know what I mean. The reality is that when you've had night after night after night of not sleeping, it really can be pretty soul destroying. I also wanted to mention that there's no doubt that diet and timing of food around sleep time is actually really important as well. There's some new research out by a group called Zoe, who are very innovative in the UK, and they're very interested in the impact of nutrition and what we eat around the time of the menopausal transition. And they have released some really interesting data recently that shows that following a Mediterranean diet, not eating late at night, and also including some things called isoflavones seem to be very helpful improving some of those symptoms as well. So after sleep problems, I would say that one of the next commonest phrases that I hear pretty much every day is, "Doctor, I just don't feel like myself anymore. I just don't feel like me." And the patients find it really difficult to actually articulate quite what they mean by that, but they just know that something inside just doesn't feel right. They feel potentially a little disconnected from people around them. As I mentioned, there can be this irritability or this quickness to anger that perhaps is quite out of personality. And they'll often describe this brain fog, these memory problems and concentration problems. They'll often describe a real loss of confidence as well, that they just don't even trust themselves at work anymore. I had a patient yesterday and she was pretty tearful telling me, you know, that they'd recently moved house and she always was a very organized person, but she just couldn't seem to pull herself together and help get the boxes unpacked and get the family organized, whereas previously she'd been this super organized person. And of course, all of this was making her feel really, really negative about herself, and there was lots of guilt involved as well. We also know that women can have really quite bad depression symptoms, sometimes for the first time in their lives, or maybe they've had depression before, maybe after they've had a baby. And these symptoms can become really difficult, but they will often describe it as being quite different to, you know, clinical depression or sort of normal depression. It feels a little bit different to that type of depression. And it is very interesting, as we often do see a very good response again to using hormones like estrogen and progesterone. I definitely encourage my patients to seek the support of a psychologist if we think that's going to be relevant. There does stand to be good reasoning that CBT or cognitive behavioural therapy can help. I mean, I definitely think it's a time for self-care and compassion. And, you know, we've obviously just talked about sleep, but, you know, giving yourself a little bit of rest and recuperation. This time of life for many women often collides with teenage or young adult children. It can bring all its own stresses. Women are often working full time as well. They're obviously juggling a household. And quite frankly, the demands on women has never been greater. The other collision is that, you know, for some women, they perhaps have neurodiversity such as ADHD that has never been diagnosed and it has flown under the radar for a long time. And this may well just be the tipping point of them being able to continue to juggle the 9 balls that they've juggled for years. I think asking for help from family members, partners is really, really important, but that can be easier said than done. Not everyone has a really supportive partner, or not everyone lives with family nearby. So it's definitely a challenge. And what I love is the sense of community that seems to be developing, even in online forums. And, I know that I often run events for education around the peri and menopause, and I know that a number of women have really made friends and continue to meet up after attending those events. So I think having a sense of community and sharing how you're feeling, because keeping all these feelings inside is not good. I know that I would consider myself a bit of a worrier, but I wouldn't consider myself a terribly anxious person. But I know that I have felt at times increasingly anxious. And, one of my examples would be in the car, even when my husband, who's a very cautious, careful driver, I could feel myself, imaginary braking whenever, or telling him to slow down, or like holding onto the handle on the door when we were going around a corner. And, it was really an over the top response to, really very safe driving. I also have patients who describe that they no longer feel like they can public speak like they did before, or that they can present at work like they did before, because they're feeling so anxious and they just don't seem to have the confidence in themselves that they had before. So I suppose my message on this front is that you're not alone. This is common. It's much more common than you would think. And it's definitely something that we can help you through. So don't be suffering in silence. You're not going crazy. You're not developing dementia, which so many people are paranoid. People often think that they've got really awful diagnoses because they just feel like their brain is so foggy and they can't trust themselves anymore. But I assure you, it's highly, highly unlikely that that's the case, and much, much more likely that your brain dysfunction is related to your hormones. And as I said at the very beginning, for so long, this period of time has been talked about as if it's all about periods and it's all about fertility. But what we now know is that these hormones are very, very powerful neurotransmitters, i.e. messengers in the brain. And unfortunately, when the levels are either becoming chaotic in the perimenopause or almost zero in the postmenopause, you can imagine that your brain and all the cells in there are missing those messengers. Now, whenever I think about thriving into the future, I don't know about you, but going into a nursing home doesn't terribly appeal to me. And I know that's probably far ahead for many people, but I definitely want to hopefully live for a long time, but live for a long time well. And I have to say, I have always been very, very interested in these zones of the world called blue zones. So I don't know whether you've heard of them, but basically they're really fascinating places in various countries in the world where they seem to have a really bigger population than normal of people living into their 90s and 100s, but who are living long, healthy lives and still very, very involved in their community and with their families and, living out independently often. And I've often wondered, how do we get to be like that? And clearly lots of researchers around the world have, taken that a step further. Many have gone and lived in various places in the world to try and understand what are the differences. And they've studied things like the diet, the exercise habits, socialization, family structure, even looked at faith and religion to see whether that has an impact. And certainly it would seem when you have a look at these populations, they seem to pretty much get a gold star for just about everything. They seem to follow really, really healthy diets with not very much or any processed foods. They seem to have a great sense of community and family, and they seem to not become isolated as they're older. But also they seem to actually be physically stronger for much longer. And they've looked at it and tried to understand why. And they've, various scientists, and there's TV programs even on this where, they look, and is it because they eat this certain type of sweet potato or kale or a certain type of fish or a certain type of oil to cook? And probably lots of things play a part. But what is really, really interesting is that whenever they looked at a number of this group, so if we think of the group who live in Japan, Japanese people often traditionally sit on the floor to eat. So they obviously have to get up and down. And, we've all gone to the table and forgotten things, gone back to get some water or a fork or whatever. So you can be up and down and up and down. And that's very, very interesting to me. And then they also noticed another group who did actually eat sitting at a table, but actually they seem to live in very hilly environments, and that it was very much within that community that they would walk to church up and down this hill each day. And so one of the things that we seem to have gleaned from all of this is that the strength of our muscles, particularly our thigh muscles, are a really strong predictor of living long and well. And I know that you're probably thinking, well, how is this connected to the perimenopause? But you'll understand where I'm getting to in a minute. But basically, if you think about having strong thigh muscles, let's just say, what do thigh muscles do in really basic terms? Well, they let you be mobile. But you need your thigh muscles if you want to get in and out of a chair. You need your thigh muscles if you want to be able to get in and out of a car. You need your thigh muscles if you want to be able to get up and down off the toilet. So in really, really basic terms, having strong thigh muscles allows you to stay social, to stay mobile, and to stay continent. And if we look at often the main reasons why people are admitted into a nursing home, it's because they've got a cognitive problem, they've got a mobility problem, or they've got an incontinence problem. And therefore, wouldn't it be incredible if we could all really think about how we could maintain the strength in all of our body, but if we think about our thigh muscles, then maybe that would change the trajectory of what our life's going to look like. Because the reality is we are living longer and longer and longer, but are we living longer and living well? So where's all this connected to the menopause? Well, what we know is in the menopause transition, unfortunately, we lose a lot of muscle mass. Some studies would say up to 30%. And how this presents itself is not a lot of women will come and say to me, look, I feel like I'm not as strong. I have to say that's probably not the commonest thing people will present with. But what they do present with are things like hip pain. And they'll complain of things like bursitis and inflammation in the hips. They'll tell me they can't lie on their side in bed. We'll also see a really big increase in things like frozen shoulder or just muscle and joint pains. And so obviously we're at the beginning of investigating all of this, and we know there are lots of things at play. We know that estrogen, for example, is very important as an anti-inflammatory, so that's definitely an impact. But we know that women's testosterone levels begin to drop off even in their 30s, long before the perimenopause. But then once you hit the menopause, you actually lose that testosterone that's being produced by the ovaries. So by the time you're at the menopause, you probably have about half or way less than the testosterone that you had when you were 25. And that has really big impacts because we know that testosterone is really important for things like muscle. So if you don't have strong buttock muscles, so think about those massive big muscles in your bum and the ones surrounding your hips and thighs, then actually it puts a lot more pressure in your joint. And then you're much more likely to get an inflamed and irritated joint and get things like bursitis. And so while doctors like me, and I think it is still helpful, will send people off to have injections into their bursitis, if you actually don't strengthen up that area, the likelihood is that bursitis is just going to keep coming back. So I would say to you that my understanding and my thinking is at this point is that as women, we need to really be changing how we come at exercise. Not only for this longevity thing, which I think is super important, living long and healthy and well, But also, if we think about it, our muscles are definitely like a little bit of a furnace in our body they're the powerhouse where we burn a lot of calories. And if you can increase your muscle bulk back up, then you can often start to offset some of that weight gain that people are beginning to see. Now, I'm going to talk about weight gain in a little minute, but I just wanted to say that, as you can see, everything I'm talking about, they're all intertwined. Okay, so let's talk about weight. This is another big issue for women in the middle age. Lots of women will come in and say, like, I'm doing exactly what I always did. I'm eating exactly what I always did. I'm exercising the way I always did. And I seem to be gaining weight. So I'm just going to be honest with you. To be honest, across the board, almost every woman at this time of life will put on some weight. For some women, it is 1 to 2 kilos. And for others, it can be a lot more. And I think we need to try and understand why this is. And as always, it's complicated. And the reality is that we don't actually know all of the answers. For many years, women have been excluded from research and studies because we're complicated and we have babies and we take contraceptives and all sorts of things. And for many years, lots of research has only happened in men. So we actually don't know a lot of the answers. But I'm going to share with you the things that we definitely do know so far. And what we've worked out is that basically what you did before probably isn't going to work. The way you ate before, the way you exercised before, kind of the things that you got away with before are probably not going to work in the way they did before. And I definitely think, for example, it's time to give up that just, trying to think about being thin all the time and, doing lots and lots of aerobic exercise and lots of running and lots of cardio. And it's now about just trying to be strong, and because that seems to really help this situation. We know that how our body metabolizes glucose and insulin levels absolutely changes in this phase of life. It is not coincidental that there is a large increase in type 2 diabetes in this phase of life. It's not coincidental. We know there is something changing with the way our body is metabolizing sugar and how we are coping with various types of food, and that insulin resistance definitely becomes more and more of an issue. We also know that the gut microbiome, so that's the bacteria that live in your gut, that they're completely changing as well. And there's lots of research going on in this domain. But what we do know at this stage is we do need to be making really good choices to try and keep our gut microbiome as healthy as possible. And so that is all those things like trying so hard not to have a diet that has lots or even any ultra processed foods. So in really simple terms, trying not to eat things that come out of a packet or that you couldn't easily make in your own kitchen, and trying to stick to a whole food, plant-based diet most of the time, but certainly and happily having some chicken, meat and fish whenever you want to, but being very, very careful with those very processed meats like the salamis and the prosciuttos and all those things that are so tasty. But, just being really mindful about what we're putting into our gut and really bumping up that fiber intake. And the other thing that we really need to do is really look at our protein. If you actually look at most people, they actually do really struggle to eat the required amount of protein per day. But what we know with women is that actually their requirement for protein really increases in this period of time. And therefore, I want you to be really, really mindful about the amount of protein you're eating. I want you to try and make sure that you're having protein with every meal. It's so easy to get up in the morning and, have a piece of toast with, a cup of coffee, but there's no protein in that. And, then to have, a morning tea, like, have a mandarin or something. Well, there's no protein in that again. And then, maybe at lunch, you're maybe having a sandwich, which maybe has a small amount of protein in it. And then it's maybe only your evening meal where you're having some meat or fish or something that you're actually getting some protein. So it's a really big one. And it's just trying to be mindful, thinking about nuts and seeds and non-animal sources of protein, so that every meal that you're thinking, okay, maybe I'm going to have some eggs and avocado for my breakfast. And it is really, really interesting. There's definitely a really good correlation between weight and whether you're eating enough protein in your diet. We also know that in this period of time, how our body deposits fat really, really changes. So women will often come into me and really complain. They'll complain they've got little pouches of belly fat, even if they're slim, that they just cannot get rid of. They'll complain that they seem to no longer have a waist, that they feel like they're a rectangle shape. And a lot of that is, in ways out of your control, because your body has decided that for some reason, which we don't entirely understand, that it's going to now deposit fat a little differently than it did when you were younger. So often whenever women are younger, they'll deposit fat on their thighs and bottoms, but when they're older, it all starts being put into the belly area. And that is very, very tricky, because we know that it's not only that we're depositing fat under the skin, but we're actually depositing around our organs. And that's actually very troublesome. We know that fatty liver, for example, really increases in the postmenopausal period, because we're starting to pack fat around our liver. And that is not good for us. We also pack it around all our other abdominal organs and also around our heart. And we know that within this period of time, then women start to really have a really increased risk of heart disease. So not only is our body changing and perhaps we don't like the look of it, but on the inside, it's really not good for us. One of the other reasons that we think there is a change in our weight is, even things like our gallbladder is secreting less bile. And bile is something that helps us break down fats in what we eat. And therefore, if we're secreting less, it would make sense that that is impacting how we're metabolizing fat as well. And although it's not strictly a weight-related issue, bloating is also a problematic symptom that many women will describe to me. They'll say that, when they got up in the morning, their trousers fitted really nicely, but by the end of the day, they were so uncomfortable. They were having to unbutton their clothes on the drive home from work, and they just couldn't believe it, or they would feel that they literally looked pregnant. And again, there is definitely a lot of changes going on in types of fluid shifts and gaseous changes within the gut that seem to be attributable to this, but certainly bloating can make people feel, really down in the depths about how they're looking. Now, I am going to tell you that unfortunately in this situation, I actually don't find that hormones make much of a difference, in that I don't put people on hormone replacement therapy and suddenly, they're coming in and telling me they're 5 or 10 kilos lighter than they were. But what I do think, which is indirectly related, is that they're often sleeping better, their mood is often better, and therefore they're often much more motivated to make really good decisions, both on what they're going to eat and in terms of exercising. And if you kind of think about it, that makes sense, because if you think about the cycles that you had when you were a bit younger, maybe coming up to period time, you felt sluggish, you couldn't be bothered, you felt tired, and you often maybe would, want comfort food, you want to eat chocolate and snacks and things. So we definitely know that indirectly hormones will help us probably be able to get that weight going off. But I think anyone will be disappointed if they think they start HRT and suddenly all the weight will come off. Certainly that has not been my experience with my patients. I think, as I've mentioned earlier, I do think changing the type of exercise you do is also really important. I want you to really think about doing strength training. I know it's certainly something I have never done until very, very recently. I'm very new to it. I do really strongly recommend that it's not something that you just take off and start lifting heavy weights by yourself, because you don't want to end up hurting your back. But at the same time, I don't want you to be fearful about it. I think if you can go to a gym or get an exercise physiologist or a personal trainer who can really guide you, it's really quite exhilarating and invigorating. So I highly recommend it, and it definitely will help you maintain your weight a little bit better. So let's talk about sex and intimacy. So again, a very, very common reason that women will come to see me is that they feel that their libido or sex drive has absolutely disappeared. And I think in the context of the perimenopause and postmenopause, there are kind of two issues. And of course, they're, as everything, related. But there's a lack of sexual desire, which is probably very much a brain symptom. And then there's also vaginal symptoms, which can be anything from a little bit of dryness, sex feeling a little uncomfortable or unfulfilling and frustrating, right down to sex being downright painful. So for some women, their vagina and vulva becomes very atrophied. You can imagine it nearly as sort of red, dry and raw. It's a bit like having a carpet burn. And you can only imagine that if you're having sex and something's rubbing up against the equivalent of a carpet burn, it's going to be extremely unpleasant. And therefore, I think we have to think about both of these symptoms. So the desire on one hand, but also you're definitely not going to have desire if it really hurts as well. So the good news is that you do not have to put up with these vulvovaginal symptoms. I've done an earlier episode called genitourinary syndrome of menopause, and we'll put a link in the show notes to tell you about that one, so you can go and have a quick listen. It's only 10 minutes long, but I think it'll tell you a little bit more. But the reality is that if you've got, you feel dry, if it's uncomfortable to wear trousers or tight clothing, or maybe that you feel itchy or burny, or sex feels really uncomfortable, or when you do have sex, you have to repeatedly go to the bathroom, or you're always getting UTIs, then this is a really clear sign to me that you need to be really considering vaginal hormones. And that can be either vaginal estrogen on its own, or now there is another product called vaginal DHEA. And the interesting thing about DHEA is that our body converts DHEA to either estrogen or testosterone, or both. And therefore, if you give the body, the theory is, if you give it DHEA, it makes what it wants. So there are a couple of products. There are pessaries. In Australia, there is a cream. There's this DHEA. I know in other countries, they have rings and various other things. We don't have those here, but there are definitely options. And this is one thing that I have to tell you as a GP. I have so many older women who come to see me, and honestly, if you look back in their notes, every month they're, women in their 70s and 80s, and they're constantly literally come to the GP with a little bottle of urine in their handbag because they just perpetually have UTIs. And the most incredible thing is that, it's such an easy fix for many of these women. And actually, vaginal hormones really don't have an age limit. You can actually start these when you're much older, and it can just be completely transformative. Some of the studies done on this will show that using a vaginal hormone will reduce your risk of having a UTI by between 50 and 80%. So I have to say, I definitely think this is a bit of a no-brainer one. It is one of those ones that I ultimately encourage people to stay on. So I don't want you to take it and start it and then you feel a bit better and then you stop it, because unfortunately, this is one of the set of symptoms that in the postmenopause tends to get worse. It doesn't get better. And it can really be transformative, not just because of sex, but because you feel much more comfortable, because putting that estrogen into the vagina actually is very, very helpful to the bladder and the urethra. So the urethra is the tube that takes your urine from your bladder to the outside. And whenever that lacks estrogen, it becomes very, very irritable. You feel like you need to go to the loo all the time. You're spending your life thinking where the next toilet is, doing just in case wheeze all the time because you don't want to be caught out. And it doesn't have to be this way. I think the lack of sexual desire can be a little bit more complicated. Because obviously sometimes people are just not in a good relationship, or they're really, really stressed out, or they've got trauma or other issues going on. But let's talk about the lack of sexual desire in the context of a sort of an otherwise happy and supportive relationship. Sometimes we do see benefit whenever we put women on their estrogen and their progesterone. But for some women, there's still no improvement. And for a lot of women, there's a lot of guilt involved. They maybe have a really otherwise very happy relationship. They love their partner, but they just can't be arsed. They have no interest whatsoever in having sex with their partner. They would rather quite literally do anything else. Many of them will have sex anyway because they feel they should do. But I would love that not to be the case, because, you know, that's not nice for either partner, I would probably suggest. So I am going to now talk a little bit about testosterone. And often people are quite surprised that testosterone is such an important hormone in women, but it actually is. And if you look at women in their 20s and 30s, if you look at just pure sort of concentrations of hormones, there's probably more testosterone circulating than there is estrogen and progesterone by many multiples. So testosterone is not a male hormone, it's a human hormone, and we all have it. And testosterone actually begins to drop off in the 30s, so actually really before the perimenopause, but it then begins to decrease more and more. And once the ovaries stop working, then actually you have much, much less testosterone. Testosterone is still made in some other parts of the body, but a significant proportion is lost when your ovaries no longer work. So I think what we need to think about is women are often really scared that if they take testosterone that they're, you know, going to grow a beard, or they're going to get a male voice, or, you know, that they're going to grow a penis and things like that. And the reality is that that is just not the case at all. You definitely want to be seeing a clinician who knows what they're doing, who's confident, and who is going to provide regular blood monitoring, because I think that is very important. We are actually very, very lucky in Australia. We do have a product that is especially for women, which is amazing. In a lot of other countries, they have to use the male product and then try and use just 1/10 of the dose. But we're really lucky here that we do have that product. Unfortunately, it's not the cheapest thing to buy, but for many women, they feel that it is absolutely worth it. And in my experience, not only does it help libido for sex, but I feel like it gives people back a libido for life, a bit of a joy about life. And lots of women will also tell me that they just felt a bit mentally clearer. They had that clarity back, and they feel they had a bit more energy. Now, in Australia, it is only licensed to be used for hypoactive sexual desire or low libido. But the reality is that, as I said, there can be other benefits. Now, it's not for everyone. And I have to say that there are some patients who definitely don't get any benefit. And if that's the case, we just stop it. Because if it's not helping you in any way, then we're not going to keep going. So we've talked in depth about a lot of symptoms and a lot of things that I see in clinic, and how I think that you might be able to navigate through them. And I know I've talked a little bit about being much older, but I think now is the time that we can put the work in. So just like whenever you're at school, you have to invest time and energy to pass exams that might be years ahead, or for a career that might feel far away. Well, I know that this time of life, it's now time for us to start doing the homework about what we're going to do to make sure that the next phase of life is amazing. And you know, I think that the perimenopause and menopause for some women can be really, really sad. It can be the end of an era. They can feel sad that they're never going to have another baby again. For others, they're absolutely delighted that they're never going to have another baby. But I think it's definitely a really big period of transition in life. And what I now want to do is just pull together what I've said. And I use a framework that I've just pulled together called She Thrives. And that is using an acronym, She Thrives, for what I want you to remember, I want you to do. So the first one is S for strength. I really, really want you to think about changing how you're exercising, and there needs to be much more attention paid to resistance and strength training. And that will be transformative for many, many of your symptoms, and also making you live long, healthy and well. I want you to think of H for hormone harmony. And I know that some people can't have hormone replacement therapy, but many people with whatever their diagnosis can definitely have vaginal hormones. and it definitely should be considered. But many, many women can have hormones. So for example, just because you have a family history of breast cancer, that does not mean that you can't have hormones. Or just because you have a family history of clots, that does not mean that you can't have hormones. So please think about hormones. They are really quite transformative for many, many women. E is for emotional well-being. It's looking after your mental health and your cognitive function. So thinking about lots of things like, making sure that you're getting adequate rest, making sure that you're not overloading yourself. And if you've stuff you need to work through, think about seeing a psychologist or a counsellor who can help you work through it. It really makes a big difference. T, so the first T in Thrives is total nutrition. I want you to think about your nutrition in a really holistic manner. And, it's not just going to be a case of a quick diet that you're going to be on for 6 weeks or 6 months. It's about looking at your lifestyle and seeing how you're going to change. And, it is probably well worth, if you can, investing in having an individual appointment with a nutritionist or a dietitian who might be able to help you really look at what your likes and dislikes are and come up with some strategies of, can you just take some almonds with you for your morning tea, or, what can you have for your breakfast that you actually like? H is for health monitoring, and this is really, really important. Now is the time that unfortunately lots of illnesses and health problems do develop as we get older. And so I really implore people to take up screening tests like the mammogram, the bowel cancer screening test, to go and have your cervical screening done on a regular basis. Have your bloods checked. Go and have your blood pressure checked on a regular basis. Keep an eye on your health. Now is the time. You've only been given one body. Think about your car. You take your car for regular services. It's now time to start regularly servicing your body as well. R is for rest and renewal. It's time to really make sleep and sleeping well a priority. Get your bedroom tidied. Get yourself some nice cool sheets. Make sure that those blinds close properly so you can have the dark, and really make a real concerted effort that you're going to leave that phone in the kitchen, so you're not going to keep looking at it or checking it in the middle of the night when you go to have a wee. Intimacy in terms of both with your partner if you have one, but just connection generally with people in your life. We know that loneliness literally kills. So this is the time to maybe regroup and maybe try and get yourself a group of established friends that are going to support you and that you can move forward with in life. And also putting a priority on maybe re-establishing that intimate relationship with maybe a long-standing partner. Maybe kids have now grown up or teenagers are moving on, and it's now time to basically reprioritize that intimate time of your life. V is for vigilance, and that is around harmful substances. I'm sorry to say that unfortunately I do see women self-medicating more and more at this stage, with alcohol particularly, and I do genuinely understand that because they're often not sleeping and they'll try and drink alcohol to help them sleep. But it's definitely a vicious circle. It doesn't help, and I would strongly recommend that avoiding drugs, alcohol and vaping is really, really important. Our bodies just don't have the ability to bounce back like they did. E is for empowerment and engagement. And I think, if you can engage in a group activity, surround yourself with other positive women and other positive role models, and just know that, this is definitely not, the end of life. In fact, it's the beginning. Look at some of the most incredible women out there. There's Kamala Harris in her 50s, hopefully about to be president. And, Oprah Winfrey. I mean, there's so many celebrities that we can look at, entrepreneurs, women building incredible businesses, doing amazing things for charity, for the environment. And, the reality is that, this is our time. We've had years where we have honed negotiation skills. Anyone who's tried to put a toddler into a car seat probably could negotiate better than any diplomat. So I reckon that this is our time, and to take this as an opportunity for really, really setting yourself up for the next phase of life. And the final S for She Thrives is for self-care and growth, personal development, Listen to podcasts. There's so many amazing books and resources out there. Surround yourself with positivity and an ability to think of what you do next. Now is hopefully the time to do that pottery class or go and do that adventure that you've wanted to do, and maybe go off and do something and step outside your comfort zone, because I can assure you that, this life, I think we've probably only got one, so it's time to grab it with both hands. I'm really hoping today has been helpful. I've tried to go over the commonest symptoms that I see in clinic and what I've done to help my patients with it. I really hope some of it has, been able to hit a spot where you feel like, oh, that's me. And hopefully you now know that you can do something about it. And if you just sit back and think about the She Thrives framework of what you're going to do, then I think it gives you a really good blueprint of how you're going to thrive moving forward. I really hope that today's podcast and all the podcasts that I've recorded so far have been helpful. I would absolutely love if you would share this with someone that you think it might resonate with. And I'd also love if I could ask you if you could leave our podcast a 5-star review if you've loved it. And if you could also consider subscribing. The more subscribers I have, the easier it is for me to get incredible guests for you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.